coming in person if you're here. I know it's a rainy, cold December night. And if anyone's live streaming in, thank you for coming. I hope you find it helpful. I'll leave my information up in the end if anyone wants to reach out or has any questions. My understanding is that on the live stream, you can't type in questions through the live stream. So in the end, if you have any, I'll give you my information. We'll do it that way. Okay. So the topic of this parent university is anxiety and school avoidance in children. And I guess when I say children, I mean any ages really, from post preschool, post pre-K through high school. So maybe it should really be in children and teens. And the reason why we're doing this is because my understanding in this district is that there all over the nation, there had been an increase in school avoidance post-pandemic, which makes sense, and we can go over the reasons why. Well, now we're almost 5 years post-pandemic, and we would expect that the numbers would go up and then would kind of go back to baseline. Baseline meaning where we were pre-pandemic. I have to say by the microphone, and I talk with my hands a lot, so this is going to be challenging. But the numbers haven't gotten to baseline. They're still too high. So we had this surge of school refusal and school anxiety, and it's not going down the way we would expect it to go down. So I understand that this has been challenging for people in this community, across Long Island, across the country. So we decided to present on this. I'm happy to go in any direction anyone finds helpful. I'm a psychologist. I work with children. I work with families. So I will feel free to ask questions. I have a slide with questions in the end, but I'm happy for everyone who showed up here in person to ask questions as we go. So the other thing I just want to point out is that school avoidance is a big topic. School refusal is a big topic. It doesn't always mean anxiety. Children could be refusing school for a number of different reasons. Let's say I don't want to do my homework, right? Maybe I don't want to do my homework because I don't want you to tell me what to do, and there's a power struggle. Maybe I don't want to do my homework because I have a learning disability, and it's such a struggle. And when I try to do my homework, I'm telling myself I'm not good enough, I can't do my homework. Maybe I don't want to do my homework because I have anxiety. Okay, I'm using homework as an example, but school avoidance can be from defiance, can be from opposition, can be from a number of different factors. But when I was talking to Mr. Doherty and knowing the field in general, I was asking, well, what do you think the bulk of the school refusal is about? And anxiety seems to be the bulk of the reason why kids avoid school post-pandemic. So we're talking about anxiety, and we're talking specifically about anxiety in general, and specifically about how it might manifest in school avoidance. So if there is school refusal or school avoidance because of opposition, we're not really addressing that here, but we could. But this is really geared to that. So just a little bit, using the wrong, a little bit about me, just so you know. So I am a co-president of North Shore CASA. And if you are not a member already of North Shore CASA, please give your email address to Renee in the back. It doesn't mean anything. You don't have to pay any money. There are no obligations. All it means is you're going to get an email once a quarter with our beautiful newsletter, and you don't have to read it if you don't want to. I was recently elected co-president with Sean Traeger, and we do some wonderful things for the community. We have a lot of parent education. We have events. We have fundraisers. Our mission is to prevent youth substance use, and we collaborate a lot with the school district. As you can see, this is in collaboration with the school district. So if you are not familiar with North Shore CASA, please visit our back table. And if you're live streaming, please go to our website and give us your email address. So I'm going to mention that again in the end. Okay, so I'm also a psychologist for, I don't know how many years now, like over 15. I co-own a private practice called New York Behavioral Health, actually, with my husband, Ryan Fuller, who's we met in grad school. So we've had that practice for a while. And that is the QR code to our website if you're interested at all. And I can put it up in the end also. And right there to the left is my Instagram that I was forced to start doing about a year ago. And I give lots of parenting advice, and it's geared to moms and dads, but most of the followers are moms because I do a lot of mom guilt stuff. But if you feel inclined to follow, that is the QR code to that. But I can put it up again in the end. Okay. Oh, I'm sorry. And the most important job is that I'm a mom of two, and they're older than that. But I have two elementary kids. Okay. Well, why does it matter? I mean, I don't really need to go into this, do I? It matters because it's huge. So there's been a rise post pandemic. It impacts social functioning. It impacts emotional functioning. It impacts academic functioning. And the collaborative role between parents and the school and educators, that's where all of the current literature and research is moving toward in the area of school avoidance and school refusal. It is the collaboration. And I could speak from firsthand experience that Seacliff Elementary is absolutely amazing at parent collaboration when it comes to school avoidance and school refusal. It really is. It really is key. So, like I said before, how are we defining school refusal? And we're defining it as an anxiety um, based refusal to attend school, different from truancy and defiance. Okay, um, different underpinnings. What are the symptoms? This is, on the surface, I've treated, hundreds of patients and seen it firsthand personally. And on the surface, it seems like, oh, they're not going to school. They'll figure it out. But when you're a parent having to deal with a kid who is engaging in school refusal, it is heartbreaking. It is gut wrenching, and it is so hard to manage. So the emotional distress for the kid, the emotional distress for the parent is probably equal. It is really, really tough. And without the support of the school and the people in the school and people around you, it's a very, very hard thing to get through at any age. After kindergarten, it developmentally, it's not within norms. It depends on the situation. But after like the kindergarten age, really shouldn't be seeing the separation anxiety like that anymore. So you see somatic complaints. So this is I have a tummy ache, I have a headache, I don't want to go to school, I got to go to the nurse's office. If you have a kid with school avoidance, this might be very familiar to you. And I want to say something. It's not always a fib just to get out of going to school. Most of the time, they really do have a bad stomach ache or bad headache. So the things in your brain that control happiness and anxiety and depression, one of the neurotransmitters is called serotonin, and you think, oh, serotonin's in my brain. There are more serotonin receptors in your gut than in your brain. So if you're having school refusal and anxiety, you're most of the time the stomach is in knots. I had a client once who we were just dealing with vomiting, like just constant vomit because of school refusal. So you don't want to assume that I have a tummy ache, I have a headache, I don't feel well, is only a way to get out of going to school. Sometimes those symptoms are very real, and it's really hard to watch. So that's why also having the school nurse kind of in the know about this stuff is usually important because oftentimes these kids end up in the nurse and you want to have a plan for when that happens. Reluctance to leave home, obviously. I wouldn't want to leave home either if I felt like that, right? So we're differentiating this from the other school attendance problems. This is an anxiety related situation here. Reluctance to leave home. Home is usually a safe and cozy place, but you don't want it to be too cozy. We make our kids too cozy sometimes, right? So no one wants to leave home if they have to go to school and they have anxiety. Sometimes it can't be that cozy. Okay, um, it's hard to do. Okay, so there are different reasons why it happens. Um, so everyone has individual factors. Um, I have here anxiety disorder. So, all of you are probably familiar at this point with the fact that people who develop anxiety disorders have a predisposition to develop it, meaning all of us are born with a certain temperament and a certain genetic loading for different things. So, people who are predisposed to have an anxiety disorder, not all of them will develop an anxiety disorder. People who were in 9/11, okay, and were exposed to the same trauma, not all of them developed post traumatic stress disorder. Why? Because the ones who didn't have the predisposition to develop that disorder. So, not everyone is predisposed to anxiety disorder. Then we talk about, well, if you have 100 people and all of them have the gene, why don't all of 100 of them develop them? Because we have this amazing field called epigenetics, and it has to do with you can have a gene for something, but it's the environment that you're placed in that determines how much of that gene is expressed or not. So if you have a gene for an anxiety disorder and you're in a home that provides stability, predictability, love, structure, not chaos, no trauma, all of those things, you will be less likely to develop an anxiety disorder than a child that is in a home that has instability and chaos and unpredictability and trauma and all of these other things. They can have the same genetic loading for it, but the ones who are in more unstable environments would make the expression of the gene come out more. And then, of course, besides the things that go on in the home, there are things go on outside the home that are beyond our control, right? Kids could be bullied. Kids can have a trauma that have nothing to do with going on in the home that can also result in the expression of the anxiety disorder. Okay, so when we talk about individual factors, all of us are so different. You can look at your kids and say, "Oh my goodness, that is exactly the same thing I have," or "That's my spouse." It's just like this kid is like this, and this kid they say two kids raised in the same home are not even raised in the same family because the one who comes second has a totally different family dynamic than the one who came first, right? So everyone has such individual experiences and genetic loading, which is with the individual factors. That's why sometimes when a situation gets complex, you need a mental health professional to really dive in to say what's going on here. And then, learning disabilities too, which can lead to anxiety. I did a whole presentation once in Oceanside about the emotional repercussions of learning disabilities. And anxiety is one of them, and depression and like a lower self esteem. And then, of course, we have the family and the social, the peer relationships, bullying. And then we have the post pandemic situation and things going on in the school. Okay. Well, this is post pandemic challenges. I don't think anybody is going to be surprised by any of this heightened attachment. But when I say post pandemic, I mean, I don't know. I really have to dive into the literature, but we're 5 years out. So there must be a way that they're separating the first year out, the third year out, and the age. When my son, he was 3 years old, that is completely different than the sixth graders who were in the pandemic, right? There are so many factors and variables going on. We're 5 years out, but yes, there was a heightened attachment to home and family, right? Absolutely. And then there was a disruption in routine. And then there's increased separation anxiety in children and parents. Okay, so not to add to anyone's parent guilt, but don't think that our need for our children to be cozy um, doesn't have anything to do with their need to stay cozy. You see what I mean? We have a really hard time with being uncomfortable. So I don't know what is going on with the Gen X people because I'm one of them, but we need to start being uncomfortable for our kids' sake, I think. Okay. All right. I want to explain this to you just so you understand if you're not familiar with the anxiety model, so you get it. So, anxiety means I'm in danger. And evolutionarily, if we didn't have it, we wouldn't be here. You have to be able to experience danger in order to survive as a species, right? So it's an adaptive emotion as opposed to something like guilt that's kind of useless. Um, we need anxiety. The problem is now we have false alarms going off right and left because we think we're threatened when in reality we're not. So for the kids that have anxiety related to school avoidance, it's because the scared feeling got fused with the school experience. Okay, they got stuck together. It's like a dog phobia. Let's say a kid has a dog bite, gets a dog bite, was never scared of dogs before, and gets a dog bite. Now I'm scared, and now scared. The way the brain works, scared and dogs are stuck together. They're stuck together. It doesn't matter how irrational it is. It could be a cute little puppy. You can't reason with it. Scared and dogs are stuck together. Okay, so something happened to whatever child is going through school anxiety, school avoidance, where anxiety and school got stuck together. Whether it was they fell off the playground monkey bars and got the wind knocked out of them and then started like hyperventilating, and now school is associated with that feeling. Or they were bullied in school and now have anxiety about seeing the kid again. It's stuck to that feeling. Or they didn't do well on a math test and the kid made fun of them saying, "What are you, stupid?" And now they have test anxiety, right? Now anxiety stuck. So now you have it stuck. Okay, now I'm scared of school. That's the first thing. The brain perceives the experience as dangerous. Now you have number one, school and anxiety are stuck together, and now we maintain it's maintained. It's maintained by school avoidance. And how is anxiety maintained? It doesn't matter if it's school anxiety, worry about going to a doctor's appointment, any kind of anxiety. The only way people develop anxiety disorders is by avoidance. That's it. There are actually some, like, there are people in the field that think if there was no such thing as avoidance, depression and anxiety just wouldn't exist at all. Like, the only reason there is depression and anxiety, there are depression and anxiety, is because of avoidance. And what is avoidance? It's I feel uncomfortable. In this case, I feel anxious, and I am going to do anything so that I don't feel it because it's painful and it's uncomfortable. And now I speak for North Shore CASA. That's one of the things we talk about, or one of the things I talk about a lot there. What is substance use? A lot of the time, it's avoiding an uncomfortable experience, right? So it's the lack of confidence that I can tolerate an uncomfortable experience, not just that I don't like it. I don't think I can handle this, right? And so I'm going to avoid the negative experience. All right. So anxiety and then avoidance. What happens? Oh, I feel so much better. Relief. I avoid, I feel relief. I am stressed. I have a drink. I feel relief. Um, it applies to so many things. I see my kid hurting. I offer them a lot of advice so that they stop hurting. Okay, I feel better. It didn't help the kid because you just gave the kid advice and deprived them of an opportunity to solve the problem on their own. So we feel this pain when we see our kids feel the pain, and we want it to go away, and they want it to go away. So there is an immediate relief with avoidance. Procrastination is the same thing. I mean, if you're looking about any problem that you have, and almost any problem that you're going through, you can kind of tie it in to avoidance, right? I have a craving for chocolate cake. The craving is the uncomfortable feeling. The chocolate cake is the avoidance. And I want to lose 30 pounds and I can't, right? So it it requires a very high level of awareness in the moment. So you have the anxiety, you avoid, and then there's the relief. And then the brain learns that I can avoid the experiences and then I won't feel anxious. And it works. It is brilliant if the world was blowing up tomorrow, but you have a long life to live. And usually this doesn't lead to long-term goals. Usually the avoidance model, and when we do that, directly contradicts the long-term goals we have. Um, when it comes to school refusal, this is what goes on. Now, um, it's tough because as parents, we can watch this going on, but then it's like, okay, get it. I understand. I hear what you're saying. What am I supposed to do about this? What am I supposed to do about this? So let's see what, okay, this is a lot of like psycho jargon. You don't have to read it. I'll explain it to you in simple terms. Um, so exposure and response prevention is the kind of treatment that we use in mental health to treat anxiety. That's all it means. It's exactly what it sounds like. You expose the person to the thing they're anxious to and prevent them from responding with avoidance. Okay? I'm scared of a dog. I'm exposed to the dog and I'm not allowed to run away. It sounds kind of cruel. And as a therapist, it's not easy to do in the beginning because you have to really work with people to feel uncomfortable. But two things happen when you do that. When you have um, a child overcoming something, they then believe, oh, wait, I can handle this emotion. It's this thing called self-efficacy that I think is just dismal right now, especially with Gen Z. They don't believe that they can do anything. And I have a lot of reasons why I think that, but that's a separate parent you. So people don't believe they can do anything unless they do it. If your mom tells you you can do something, it doesn't matter as much as doing it and then overcoming it, right? So the habituation means the anxiety decreases over time because the kid learns, I actually can do this, okay? And what the extinction is, these are just like kind of technical terms, but this is like years and years of data. So this is the technical way this works. When you keep exposing the person to the thing they're scared of, it, remember I said they're stuck together, it weakens it. So now all of a sudden fear's over here and dog's over here, and then eventually they're separated again. But that can't happen unless you repeatedly expose the person, and then their brain says, oh wait, oh, I'm not dead, because that's what the ultimate fear is, that I'm going to die. Oh wait, I'm not dead. I can be around dogs and I'm not in danger. So now the two things are separate. Okay, so I mean that's the way it works. So what does that mean? It means avoiding school needs to be, it has to just keep being pushed until you're exhausted beyond belief, and it eventually will remit. Okay, so strategy. I'm sorry, I'm looking at the time. Strategies for parents. So transitions. Oh, I know it's hard. The Monday after the holiday break, the day. Sometimes September is not even as bad as like this holiday break or the Passover break or the Monday mornings. Um, to prepare them beforehand. When I used to treat kids for this regularly, I would meet them I would get permission from schools to go into the school in July and August to help them transition for September. I would get the guidance counselor's office and I would do my sessions. They wouldn't drop kids off to my office, they would drop them off to the school, and I would meet them in front of the school and I would do sessions in the school building to prepare them. That sometimes the school refusal can be so bad that you need a mental health professional. You know, you need more support than parent in school because over the summer schools not in session anyway. Um, but it has to be just persistent. Parents modeling adaptive coping. If there are certain strategies that help your kid to relax, then the parent does them with the kid. Or there's certain coping statements that work. I mean, we can go over all of these different things. I can even do deep breathing with you in here if you want. I can do certain coping statements if you want. But the parent's helping model. But you want to model it and you want to teach it and you want to be there, but you want to gradually remove yourself, because what you don't want to be is what we call in psychology the safety person, meaning they always need you there, because that's the problem to begin with. You need to gently remove yourself from the situation. I had a client once, and it, the safety behavior or the safety thing is only a problem if it's impairing your functioning. So, I mean, I can just off the top of my head, I can give you two examples. These are two adult clients. One of them was scared of elevators, and my office in Rockville Center, I was on a high floor. So he wouldn't come to my session unless he had a certain size of coffee in his hand. That was his safety object. But okay, like, so people have all kinds of safety objects. Like, sometimes people say Xanax is the most impactful medication that's not taken, because if people just have Xanax in their bag, if they're flight phobic, sometimes that just does the trick without actually taking it. So people have these safety objects and safety people, which can be okay. Like, my client carrying a coffee doesn't matter. It's not impairing his functioning. But needing mommy as my safety person in order to go to school can be problematic, because there's a time where you don't want mommy to be the person with you anymore. Right? Some people feel like they need a friend with them, or they need to have someone with them. So you want to model these things, but you want to get yourself away from the situation so they can do it. We all just want autonomy and independence for our kids. Relative happiness, not happiness. That doesn't, it's not a thing. Like, we're not always happy all the time, right? We want like relative happiness, but independence is really what we want. And we have to like slowly remove ourselves. Um, Telling them that you think they can do it, right? Um, I know you can do it. I know that you can do this. I've seen you do it before. I know that you can do this. Like, and believe it when you say it. Like, really, I know that you can handle this. I know that you got this. I know it's hard. I know that you can conquer the emotion, um, depending on the age of the kid and how you talk to them. And then don't give in to the avoidant behaviors, whether it's school. Look, the thing is, if they have a separation anxiety, they're not going to probably want to go to dance class or birthday parties or soccer or any of these things. Schools, the big schools, I mean, they're all important. However, they have to go to school, right? They don't have to go to dance class. So you really want to take a deep breath and do everything in your power to get them to go. And someone might say, well, I have a 16-year-old. What am I going to do? Carry him out in his pajamas? And the answer is, well, almost, yeah. I mean, I've worked with so many parents where the kids are in their pajamas without their teeth brushed, and you're getting them out. They, if the second that they know they can stay on the cozy couch, it's just got to be this constant. It is exhausting. I've been there. It's really difficult, but you all of this is treatable, by the way. This is not a doom and gloom. This is horrible. Oh my goodness. All of this is treatable totally with the right interventions, with the right people, with the right consistency. Anxiety is a highly treatable situation. We're in the middle of a mental health crisis, and I could tell you it's treatable. Just get them off social media. I'm kidding. That's another lecture, too. That's separate. I just got to throw it in there because I hate it. Okay, strategies for school staff. I don't need to tell Seacliff School these strategies because they're already so good at it, and I assume all the other North Shore school districts are. But if I'm going to brag a little bit about Seacliff Elementary, what I will say is they are absolutely amazing at building strong communication with families, because the collaboration is necessary, absolutely necessary. Without assigning blame, that's something that came up over and over in the literature. Parents feel like it's their fault, or they feel as though the school is insinuating that they're to blame. No one's at fault. No one's at fault. It's a rough situation. So communication with the school is essential, and peer engagement opportunities is great too. Again, this is something the school um, can help foster. Cognitive behavioral therapy is what we practice. It's an evidence-based therapy to treat anxiety and school refusal, and it's what we use in my practice. So you can always Google cognitive behavioral therapy. It's it's really the best treatment for something like this. So if you're looking for therapists, make sure that you're checking to see if this is the kind of work that they do. It's education, exposure, those kinds of things. Um, Involving parents, teachers, mental health providers. Hold on, I want to see if I forgot anything in my notes. Again, sometimes you need to have an outside mental health provider. I have to just say that one more time because it can just be so helpful. It doesn't even need to be long term. Sometimes parents just need support to talk to someone other than each other, and stop Googling and trying to figure it out. Talk to someone who's done this a million times, can give you a treatment, and move along. Because it can be draining. It's already draining enough with everything going on. To have to add something like this on top of everything is just completely exhausting. So I can't stress enough how important it is to just get a consultation with someone who knows what they're doing in this to help with it. And then is there bullying going on? I mean, there are so many reasons why this could be happening. Are there learning issues going on? Why is there a test anxiety? Did something happen in school? And then when you're talking about the collaborative care, which means school and parents and mental health provider, there needs to be a unified goal. It can't be, well, they have to go in tomorrow and they have to be there on time. It has to be, okay, this is our plan, this is our goal. If she goes in this many days, she'll get these kind of points or whatever it is everybody comes up with. So everybody's on the same page. And the kid has to be totally in the know of this plan. That's another thing. When I treat kids, it's like kids are in the know about what the plans are about their life. They help devise the plans. I will often, even elementary age kids, ask them what they think about the plan and have them come up with a plan. Uh, the days of this is what you're going to do, here's the plan, go do it for an elementary school kid with anxiety, no, it's more like a collaborative discussion. I mean, you know the right answer, but let them make the decisions about the things that don't matter as much. The kid has to be totally on board with something like this, as much as they don't want to go to school, a plan that they're agreeing to. So, just best practices in general, identify the true source of anxiety because that helps with treatment. Where did it come from? Why is it there? What are the underlying reasons that fear got fused with school? We're not punishing here. They are suffering enough, and so are you. They, to be punished for, we're talking about anxiety. We're not talking about defiance and truancy. I know I've said that, but there are different things going on. We're not going to punish a kid for already who's already punished enough by going through something like this, and it doesn't feel good as a parent. So we're not punishing for this kind of thing. And you want to understand. You want to understand what's going on. You're not going to have a successful outcome unless you understand what's really going on. You want to implement CBT, cognitive behavioral therapy, family interventions, things like that. Um, and then early detection, but it's usually it's detected right when it's happening, right? When they don't want to go to school, they don't want to go to school. So, but anxiety can be if they have a general anxiety, that could be detected earlier. But the school refusal is usually detected when it's happening because it's very behavioral. Okay, I have just some resources on here. There's just some articles, some resources if anyone is going through that. And if anyone has any questions, oh, there's some more of my information. If anyone has any questions for me, I'd be happy to answer them. Or you can always email. There's an email address if you have any questions for me, if you don't want to ask when we're here. Um, so I'll give you a minute to think. And if you don't have any, I am going to end with a relaxation exercise. But I hope everyone can drive home after that. Or a mindfulness exercise. We'll see. I like starting with those two, but yes, yes. Yeah, I did. Yeah, I did. I can talk about that. I know. It's a rough one. It it's a question that is not fully answered just yet. Okay. Not all screens are created equal. This question is about social media, which is not the same as video games and not the same as television, and I don't think is the same as FaceTime. Um, or if I'm missing any other screens, social media is what I believe is the worst. I do not think Gen Z would be in the problem they're in now without it. I'm sorry, let me phrase that. We, there are still problems, a lot of problems with stuff going on with that generation. I think social media accounts for a large bulk of it. Um, there are things that go on social media that lead to that, and the data is very clear. There's no debate here. The question is, what do we do about it? I get that question all the time. First of all, I just found out, and I can't wait to look into it and join it, and maybe become president of that too, because I have so much extra time on my hands. There is a new group called, I think it's called MAMS or Moms Against a new group, kind of like Mad and Sad, Moms Against Social Media. Okay, I don't want to give you the wrong information. Apparently, this is becoming something. There, everybody is. No one has any answers. Okay, because and everyone's going to go yes. Here's the problem. I don't want my kid on social media. At this point, now we're years in, I understand the risks. 10 years ago, nobody knew what was going on. No one's fault. No one knew what was going on. We all know now, okay? I have Gen Alpha kids. I'm like constantly scared that they're on the screen. Now with the elementary parents like, we got to get them off the screen, put them in more activities. So like the younger ones are in even more activities because the mothers are so scared of screens and everyone's texting. At least they're not on a screen. At least they're not on a screen, but they're just like exhausted. But everyone's trying to do something here. But the Gen Z, the poor things, no one knew there was a problem. Okay, so now we know there's a problem, and it's what do we do? But the problem is, but if they go off Snapchat, then they don't know what's going on with their friends and they're left out, and everyone says, you didn't know that? Oh, and then they have FOMO, and then we have an maybe just as big of a problem as if they're on social media. So here's where we are right now. I haven't read, the book Anxious Generation that Dr. Z recommended at the beginning of the year is amazing. He recommends different ages. If you haven't read it, you have to. It's really, really good. And he backs it up with data. It's not just somebody, he's a really well-known author for years and a researcher. And so you have to look into that. But he recommends certain ages for things. But here we go. And I'm sitting with a client and that is, but then my kid is left out. So what can you do as a parent? Can you ask the other parents? Is there a way we can limit these things? Right. But then you have to then be that parent who's being the annoying parent, telling parents how to parent. So, there's no good solution to it. All I can say is if you can limit the amount of time they're on it, because I think as a parent, we can do that. If they're on social media, if they're on screens, and I know they have to use screens for school, but over 2 hours a day is considered excessive. And this district was between 5 and 6 hours a day when we did our survey. Okay? Over 2 hours is excessive. This district was 5 to 6 hours a day above the national average. So if as a parent, I'm not saying you have to go off all of your apps and then be the only one not on the apps. But how about limiting the time that they're on the apps so that they're not getting sucked in as much? Or is it possible to have conversations with them about what they're doing on the apps? But you have to be really gentle about that stuff too, because you don't want to ask too many questions because then the kid turns the other way, right? You want it to be collaborative. You want to have a conversation like, I noticed you seem upset after that group chat. Like, what was up with that? I want to talk about it. Okay, that's fine, right? Not like what happened. What they say? What they do? Don't do this. Blah, blah, blah. They don't want to hear it. They don't want to hear it. So I would say limiting the time if possible. If you can talk to other parents that are like-minded of the same group, trying to together limit some of the stuff that's going on, and then having open and honest communication with your kids about what's going on and the dangers of it without lecturing and asking too many questions. I know that's hard to do, But we asked too many questions because we have anxiety about what's going on with our kids. And then when we ask them so many questions, they close down more. I've assigned so many clients over the years for middle schoolers the homework assignment. When I'm working with the middle schooler, I say to the middle schooler, let me do the next session with you parents. Um, your homework assignment is to not ask your kid one question after you pick them up from school for 1 week. What? Um, what do you mean? You can't, don't ask them anything. Not how's your day, not is this, what you have to do. Let them do it. Let them do it on their own. Um, so when you ask the questions, general, and you feel them out and you read them, well, I'm the parent. I should know, right? I'm the authority. I should know what they're doing. Yeah, but as a middle schooler or high schooler, that can very easily backfire. So you kind of have to do that dance until they're like 26 or something. It depends on the kid. Maybe 20, depends on the kid. Maybe 16. Um, but yeah, that's the best answer I have. But you know what? I'm going to look up that organization, and I probably am going to join it. But there is a movement for this from Moms Against Social Media. Yeah. Is there any other question about it? I mean, about anything to do with the presentation or anxiety or adult anxiety or kid anxiety, different ages? Hmm. Yes. Um, and if you say why, I just hate it. Is it big? Why? Why? Right? I'm never going to use straight angles and blah, blah, blah. Go. Yeah. They don't want, but, the, the school experience is not enjoyable for certain kids, right? The certain experiences are every individual is different, and it depends on what's your goal. Um, they they can say those things, and you can have a goal of understanding why because you want to help them, or you can have a goal of understanding why because you really want to know. And if it's because you really want to know, then it might not be necessary to ask the questions, right? But if you want to understand why, because you want to help them, so what is it? What is it about? Is it they have a hard time paying attention? They have a hard time sitting. They don't have a lot of friends. They don't like waking up early in the morning. What, are there any parts of school you do like? No, recess, whatever, lunch. Um, they and look, they might not like school and they might never like school, but what you're trying to have them understand is I know you can do hard things. Like, I know you got to validate. He doesn't like it, right? They don't. I know that you don't. I hear you. You don't like school. How does it feel when you're at school? I get it. I get it. Do you think you can get through that bad feeling? Because I know you can get through it. Like, I know that you can get through hard things. I've seen you get through hard things before. I know you can do it. And they might hate school every day. I mean, that wasn't me, obviously, right? I mean, I was in school I still want to go back. But some kids don't like school. Some kids don't like dance. Some kids don't like soccer. There might be a kid who just genuinely does not like going to school every day. And but they have to go to school. There's nothing we're doing about this. They have to go. So it's about instilling, I know that you can. I know that you can do it. And then trying to pull out any positives about it, right? Like, what do you enjoy about school? And what do you look forward to after school? And what do you look forward to on the weekends? And what are the positive things that will come out of you going to school? And if you didn't go to school, what would your life look like when you're this age? Right? Like, we have to do things we don't like for a certain reason. So having him identify, you validate, identify have him identify the reasons why he has to do it, and then kind of instilling the confidence that you know he can do it. Because the other thing is, you don't want to be like a sounding board for complaints. Kids sometimes want their parents' attention when they're complaining, and it's almost like you don't want to be that person. You don't want to be the person they're relying on to complain, because complaining doesn't actually help anybody. Complaining is a pretty negative thing. There's this research that shows every time you try it for a week. I tried it and then I forgot I was supposed to do it. I'm going to try it again this week. Every time you complain, and it's a lot, you'll see. Every time you complain, you follow it up with a positive thing about the thing you're complaining about. Like, oh, this dishwasher. At least I have a dishwasher. Like, my mother didn't have a dishwasher. And then you move on. Like, everything you complain about, follow it up. So, like, even with your kids, like, that could be something that you all try to do, right? Every time you complain, follow it up with something good. I hate sitting in class, but, at least I'm going to learn this subject so that I know how to read, when I get older. Or at least it's the last period and I'll get to play after it or something like that. But that's a homework assignment for everybody with the complaints. Yeah, you have to validate them first, or nothing ever goes anywhere good without the validation. So, yeah, some kids just don't like it. Yeah, yeah, Renee. Ooh, the perfectionist. Ooh, the perfectionist. And we have a lot of those. Um, we have a lot of perfectionists. So, what perfectionism is a certain area of anxiety. Anxiety is a lot of different. It's like a flower with all these petals. um, so it's a certain area. And with perfectionism, it's what's the worst case scenario? You take them to the worst place. When I, years ago, oh, so many years ago, um, this middle schooler had to go to Harvard. Had to go to Harvard. When I say sessions after sessions, had to have 100 average, had to do this, had to do that, had to do this. But the perfectionism is, well, she didn't go to Harvard, by the way, because I actually stayed with her that long. And she's fine, not going to Harvard. But she went to another Ivy League school, but I was hoping that it wasn't even that to show her she can survive. But the perfectionism is about what is the worst case scenario. I fail a test. And what the work you do in therapy with a case like this is, does the person believe that they can tolerate the worst case scenario? That's usually what anxiety is about. It's, do I believe that I can tolerate? So I fail this, then what? Do you know how many times I've sat in sessions with kids calculating GPAs? Like, if you fail this one test, what does that mean? And like crunching numbers. So it means what? You still got an A in the class. Or it means what? Okay, so you'll get an A minus in this, and how does that affect your overall GPA? Right? Like, what's the worst case scenario? And then what does that mean? And can you tolerate that? Perfectionism, it's an it's unattainable. Like, with perfectionism, it's never, you're never satisfying it. You're never ever satisfying it. So it's going with them to the worst place, like really going with them to the worst place, and getting to them in the place where they believe, not the end of the world. Like, all right, it's not that bad. It's not that bad. It could be worse. And lightening up the load, easier said than done. Lightening up the load. It, everyone's just doing too much. Myself included now, right? Any other questions? If anyone live streaming has any questions, you can email them to it's the practice email, not my email. So it could eventually get to me if you put my name in it, but it will get to me. Just put my name in it. It's the info at New York Behavioral Health. You can also call. Go on the website. There's a contact form if you wanted to set up an appointment, whatever. And so, can I take a little vote and can we just do like a 3-minute exercise? We're going to do one of two. It either be mindfulness or it will be relaxation. Those are not the same things. Mindfulness and relaxation are not the same things. Who votes for mindfulness? Who votes for relaxation? Oh, I'll do both. I'm going to do mindfulness first in case anyone feels an anxiety come up when we do mindfulness. Then we'll end it with the relaxation. Okay. We'll just do a few minutes. Okay, so even if you're live streaming, can you do this? Even if you're in bed with your kids, close your eyes. If you don't feel comfortable closing your eyes, you can close your eyes like 90% of the way and focus on a spot on the floor. Or if you feel comfortable closing your eyes, you can close your eyes. And all mindfulness is paying attention to each moment in that moment. That's all it is. There's nothing mystical about it. But it's looking at the moment not judgmentally, not labeling any experience that you have as good or bad, but just looking at it for what it is. So for the next minute, I would just like you to focus on your breath. In every moment, stay on your breath. So watch the breath as it goes in. And then when the inhale turns into an exhale, notice that moment. When it goes back out, the exhale turns into an inhale. You're not changing the breathing in any way. You're just letting it be there. If your mind wanders, that's perfectly fine. Notice where it went, and then bring it right back to the breath. Every time your mind wanders, bring it back. And since you're sitting here, we're going to transition. Keep your eyes closed. We'll transition to relaxation. What we're going to do is I'll walk you through it. You're going to breathe in through the nose for 5 seconds. When you get to the top, you're going to hold your breath for 4 seconds. And then you're going to breathe out slowly through pursed lips for 7 seconds. And we'll do that. I'll walk you through it. So breathe out all the air. And breathe in for 1, 2, 3, 4, 5. Hold your breath. 1, 2, 3, 4. Slowly through the mouth. 1, 2, slowly. 3, 4, 5, 6, 7. In. 1, 2, 3, 4, 5. Hold. 1, 2, 3, 4. Out. 1, 2, 3, 4, 5, 6, 7. Last one. In. 1, 2, 3, 4. Hold. 1, 2, 3, 4 out. 1, 2, 3, 4, 5, 6, 7. Okay, you can take a deep breath in and open your eyes when you feel ready. That last one is called paced respiration, and it is great. It works on your nervous system to physiologically calm your body. You can give it to your kids. You can do it. Do it like 5 to 10 times if you're ever feeling stressed or wound up or tense or whatever. It's just like a great tool to have in your back pocket. So I hope everybody is awake enough to drive home on the rainy night. And I am around if anybody needs anything. I'm always here. So thank you so much for coming in person. If anyone's on live stream, and if you're not a member of CASA, please join at the table in the back. Thank you so much.